selection of people joined us, and it's lovely to see you all there. So we've got some schools from obviously network schools, and what's lovely is some representatives from new schools, because we're in the middle of recruitment drive, as well as sort of partners and healthy schools staff from around Wales. So lovely to see you. Just for those who haven't joined us before, just to remind you how this works. So we will be the royal we, actually, Rhiannon by my side, will be giving a presentation, and then at any point in that presentation, if you want to type a question, if you look to the bottom left hand of your screen, you'll see that it says send to everyone. So as a question pops into your head, just type it there, and then I can ask it on your behalf during, as we go through the presentation at a convenient moment. And then towards the end of when Rhiannon's finished speaking, we will open the microphones. We realise it takes, you need to be quite brave to be able to speak, but if you have got a microphone on your laptop or your computer, you can ask a question. So that'd be lovely, but you can also continue to type. And so we'll make sure that those questions are answered. So I think that's all we really need to say, other than I'd like to formally thank Dr. Rhiannon Evans for coming to give our webinar. She's going to report back on her research in terms of self-harm, and School Health Research Network has been a sort of very important part of that. So I'll hand over to you, Rhiannon. Thank you so much.
Thanks, Jan. So welcome everyone to the presentation today. So just to give you a little bit of context really of the research that we did. So in January 2015 we were awarded a small amount of money from the GW4 grant. So this is an increased collaboration for universities between Exeter, Cardiff, Bristol and Bath. And I was funded to set up the Children and Young People Self-Harm and Suicide Research Collaboration. So in January of 2015 we had a consultation in Cardiff, which some of you may have attended. We tried to start to map the research agenda for schools and what they wanted to do around self-harm and suicide. One of the big areas to emerge as important to schools was self-harm, school-based prevention. So we pursued a further grant which was awarded, and in the last year we've been trying to more systematically map what schools currently do about self-harm, but also what their future prevention and intervention needs will be. So really today I'm just going to share the results of that larger consultation to give you a picture of what's currently being done and what schools want to do moving forward. So one thing to note is obviously today's going to focus on the Shern network and the Shern schools that participated in the consultation, but we will distribute this sort of presentation and slides to schools in South West England that also partook in the study, because the study was primarily done in consultation with the University of Exeter and led by Dr. Astrid Janssens, who works in the medical school there. So just to give you a little bit of background context to self-harm and suicide in schools. So when we talk about self-harm, we tend to refer to an act which has a non-fatal outcome, when an individual engages in a behaviour or ingests a substance with the intention of causing harms to themselves. There is a lot of debate about the suicidal intention associated with self-harm, but it's kind of a little bit contentious at the moment. But essentially, behaviour doesn't lead to the completion of suicide. So despite some debates about conceptualising what self-harm is, we do know it's a growing problem with children and young people in the UK. And recently, data has indicated that almost 19% of 16 to 17-year-olds have engaged in some form of self-harm across their lifetime. And there's been a progression really in the evidence base for school-based interventions for suicide and suicide attempt. So there was a big study last year called Saving and Empowering Young Lives in Europe, which showed the effectiveness of promoting children and young people's mental health in reducing thoughts of suicide or suicidal ideation and suicide attempts. But to date, we don't really have any evidence of effective interventions for the reduction of self-harm broadly, but also with a specific focus on educational settings. So the research questions that we were funded to address were these three. So what we wanted to try and map was what student self-harm prevention and intervention activities are currently being delivered by secondary schools in England and Wales. Progressing on from there about what are the prevention and intervention needs that these schools might have in regard to student self-harm. And at the time of starting the study, we really wanted to see what might be an acceptable and a feasible approach to preventing and intervening with self-harm. But as I'll touch on, this question has kind of suggested that schools might not necessarily be sites at the moment for effectively addressing self-harm. But that's not to say it wouldn't be in the future. So just to briefly outline the methodology of what we did in the study. So the figure shows our recruitment in Wales and in South West England, primarily around the Exeter area. So we took a cross-sectional survey, which is a survey at one time point with a sample of secondary schools in Wales and in England. So we tried to recruit all schools that were in the SHARE network in Wales. And within that, we recruited schools for qualitative consultation. So we had 4 case study schools in Wales and 4 case study schools in England. And those schools were recruited from the original sample who completed the questionnaires.
Rhianna, I just wondered whether it's worth, certainly for the schools new to the network, that the questionnaire was actually within the school environment questionnaire, so it was a little sort of section, wasn't it, sort of separate to to you know to that. So you're going to talk about that?
Yeah, no, it's okay. It's okay. So and our inclusion criteria for the schools were that they were state funded and that they weren't independent schools. So in terms of the survey or the questionnaire, so I'm just going to talk about Wales, but there was a parallel survey in England. So what we did was sample the number of schools that were in the SHARE network, and then we looked at those eligible schools, which were state schools. And we asked them to complete a supplementary section of the School Health Research Network environment survey. So some of you might remember completing it at the back. There's probably about 20 questions about what you do about self-harm. So that's how we generated the data in that instance. So 94 of the eligible schools responded, which gave us a response rate of 84%. So it was actually incredibly high. So it gave us a good sense of what was going on in schools. And then we just contacted schools that didn't respond to find out why they didn't. And it was mainly that they just had forgot or didn't have time to complete it. And the primary person who responded and completed that section of the SHARE environment questionnaire was assistant head teachers. So then I just say about the qualitative consultation. So the last question on the survey, schools were asked to indicate whether they're prepared to participate in future research in relation to student self-harm. And then we attended the SHARE conferences in North and South Wales, which happen on an annual basis, just to flag up the study more and see if people wanted to partake in it. And then we tried to stratify schools. So we had a sample across a wide range of sort of socio demographics like preschool meal entitlement. So yeah, in the end we had 4 schools in Wales that took part in this section. So I'm just now going to map through the quantitative data that we generated. So the first couple of questions, we have them by study site, so we have them separated for Wales and for England. A large part of the data is provided with both sites combined, so it's data for England and Wales. And often there actually wasn't that much systematic difference between the data being provided. So it should still be telling and informative to you. So the first thing that we tried to explore were what were the health priorities of secondary schools in Wales. So outside of the academic curriculum, what did they feel was a priority for them to address? So you'll see that emotional health and well-being was ranked as the highest priority by schools. So 60% of respondents said it was the highest priority for them. So that's significantly more than any other health outcome that they were given an option of. It was interesting, the suicide and self-harm was sort of patterned in a way that people tended to say it was a high priority or not a priority at all. So 13% ranked suicide as the highest priority, but 40% said that it was their lowest priority. So again, with self-harm, sort of 25% said it was the first or second priority. 27% said that it was the 8th priority. So there was no sort of clear sense of it being an absolute priority or not a priority at all. There was a lot of split there in terms of what schools were saying. So in this bit I will provide the comparison with England. So interestingly, we'll see almost an exact same number of schools ranked emotional health and wellbeing as a very high priority. So in this case, 61% as opposed to 60% in Wales. So it's very similar data there. And these schools tended to rank self-harm and suicide a little bit higher. And then the next thing that we wanted to know was broadly how useful did schools find different approaches to health promotion and intervention. So there wasn't linked to self-harm per se, but just generally what did they use for promoting any sort of health topic. So the thing that came up as being the most useful was one-to-one intervention. So 68% respondents said that one-to-one intervention had very high utility. So someone, including a teacher, might directly work with a young person. 47% of respondents said that external training had very high utility, and 38% said targeted approaches were high utility. So what we got a sense from schools was that where a health behaviour might have started to emerge, or they thought a school was at particular risk of a behaviour or outcome, they directly worked with them, and we saw that as being the most effective approach. There was a slight difference, interestingly, between Wales and England on whole school approaches, where you might try and transform the whole school context by promoting a positive ethos, by having school policies, etc. So 49% of schools in Wales said they thought this had very high utility compared to 30% in England.
That's really interesting with the Healthy Schools approach. So
yes, the Healthy Schools promote
in Wales than in England.
And the other interesting thing I thought was 49% of respondents indicated posters and leaflets only had moderate utility. So it's actually something that has historically been used quite a lot in health promotion, but many people didn't really see that it was an effective way of addressing the health of their students. And the next thing that we moved on to was trying to ascertain really what schools felt were the self-harm behaviours in terms of how they might define it, but also how prevalent that they thought it was. So it was quite unsurprising really that cutting emerged as the main behaviour that schools are taught and that they feel that they see within their setting. So 22% of respondents stated that the prevalence of cutting was very high, so that was seen as higher than any other self-harm behaviour. And 49% of respondents said that the prevalence of cutting was average. So we did pre-specify a prevalence rate for that, so that they had a benchmark to compare it with. So there were additional self-harm behaviours that we didn't specify to schools for them to rate. So schools mentioned overdoses, just broad risk-taking behaviours, sexual risk-taking, and interestingly, one school said that they thought sleep deprivation was a key self-harming behaviour the students were starting to engage in. There were quite a few unknown responses provided by schools, but they all came from the South West England participating schools. So I think from there we can summarise that self-harm in the form of cutting is the main behaviour the schools are addressing. So then we moved on to trying to consider what is it that schools actually currently do in terms of self-harm prevention and intervention, self-harm prevention provisions. So this was just trying to map the existing context. So the majority of schools said that they mainly relied on health service provision for addressing self-harm, and this was evident in the qualitative data as well. So CAMHS was the main service that was utilised. So if a student was known to self-harm, then a referral could be made to CAMHS. Then the second main provision was on-site counselling. So 79% of respondents indicated that they use this when a student self-harms. And then within this, schools were also given the option to say if they didn't have something, but they would really like to have it in future. So the main ones that came up was specialist training to students. So 36% of respondents said that this is something that they would really like to provide. Interestingly, despite the previous slide saying that no one really thought posters was that effective, 27% of schools said they would like some posters on self-harm. They'd like more outside speakers. And one of the threads I think came up throughout both the quantitative and qualitative data was providing more training to staff, especially in the qualitative data. Staff spoke a lot about having to deal with disclosures of self-harm or detections of self-harm and having to manage the process and holding students within the school until they could seek professional external help. So schools wanted some more training in order to support staff in this task. And then the other thing that came up was about assemblies. So this again is quite a complex one because 21% of schools said they would like to give more assemblies in this area, but the qualitative data kind of sat in tension with this, and I'll go on to this more when we get to that section. But there was a real fear in schools about overtly discussing self-harm with the general school population. Mainly there was a fear about encouraging self-harm if schools spoke about the behaviour to individuals who weren't already engaged in it. But I'll tell you a little bit more in a minute. And then an extension of, well, what is it they do? We asked them, well, how useful are the things that you currently do? So schools were asked to rank the different options of provisions. So counsellors came up as the most useful resource that schools currently utilise. So 25% of schools ranked it as the first option, and then CAMS was seen as the second most useful, and then teacher training, so 12% ranked teacher training as the third most useful option. There was some difference in ranking across the Welsh and South West England sites. So in Wales, counsellors were the most useful, CAMS was the second most useful, and school policies and procedures was ranked as the third most useful in 11%. So in Wales, we did see sort of the privileging of these whole school approaches and policies and procedures coming up quite a bit. In South West England, there was a different focus really on what had the most utility. So outside speakers were ranked as the most useful in 22% of cases. Counsellors were there as the second option, and teacher training was seen as third most useful. 14%. So teacher training was most useful. I think I might not have fully explained that slide exactly right.
Well, it is quite interesting that there are differences, because that was one of the things I was quite interested in coming into this, was the difference between England and Wales.
Okay. Then the next couple of slides then was about who delivers the prevention and intervention activities that schools currently engage in. So kind of based on what I previously said about counsellors and CAMS, I think it's an extension of that. So the professional roles most involved with the delivery of prevention and intervention were pastoral care teams, school counsellors, school nurses, and CAMS provision. So they were the main organisations involved. And I think interestingly, based on what we were saying earlier about the need for more teacher training, 79% of respondents said that teachers were involved in intervention delivery about self-harm. So they do have a real key role in it. 45% of respondents stated students were involved somehow in intervention. And respondents in Wales tended to say that more professions were involved than schools in England. And then the last but one slide we have on the quantitative data is really trying to focus in more on the student and staff training for self-harm. So what we saw was, in terms of receipt of training, only half of schools really said that they received voluntary or mandatory training for staff on self-harm. And the people who tended to deliver this training, so 31% said that CAMS came in and gave some support to school staff in how they can manage and address self-harm. But in Wales in particular, 51% of schools didn't specify who the actual delivery agent of this training was. In terms of the funding, so in South West England, high percentage of schools funded the training themselves. So in 30% of schools in Wales, training was funded by the school themselves. And then moving on from there, then we asked really, well, how adequate is the training currently received for school staff? And it was very mixed. So we saw a lot of variation. So 52% of schools in Wales said that the adequacy of training currently received was moderate. So it wasn't particularly good or bad. So a few schools which said that it was highly adequate sort of spoke about self-harm being at the forefront, that there was clear strategies. Moderately adequate schools said there's some strong individual support but very few proactive strategies. And that came up quite a lot throughout the data, was the sense that schools often were quite responsive and reactive to episodes of self-harm in students, rather than having a predetermined set of procedures or practices which they enacted when instances of self-harm arose. And the low adequacy of training, so it was that tension between education and health, I guess. So one school said a school's core business is to educate young people. We refer self-harm to specialists to deal with. And then the final slide was trying to think forward about, well, how might we do something about self-harm and what might be the barriers to delivering some prevention activity. So actually I thought this was quite heartening, really. So the most frequently cited barriers were, quite expectedly probably, lack of time in 47% of cases, inadequate time in the curriculum, lack of staff training again, and lack of available resources. But quite interestingly, and maybe positively, was the least frequently endorsed barriers. So i.e. that schools didn't think it was a barrier, was it not being seen as a problem by management, not being seen as a problem by teachers, or students not engaging with the topic. So actually schools are saying that self-harm is a priority for them, that students are engaged in discussion around self-harm. So I'm just going to move on now and do maybe 10 minutes presenting the qualitative data and how this fits with the survey data that we had. So the first thing that we really discussed in focus groups with school staff across the case study schools was how they conceptualise self-harm. A lot of it resonated with the broader literature that we see around self-harm. So we tend to often see sort of typologies of self-harm or types of self-harm that falls into the category of minor, inauthentic, often visible self-harm, and then on the other hand, severe, authentic, invisible self-harm. So there's different understandings of it. So teachers spoke in this way a lot. They talked about the severity of self-harm as students who were superficial cutters and those who had very deep cutting that could go down to the bone. Then they also spoke about different types of self-harm, and then went on to the reasons why young people might self-harm. And this is where sort of visibility and invisibility really comes to the forefront then. So they often talk about young people engaging in superficial, visible self-harm, which is done with the intention of being seen by other people and is a cry for help. And then there's the more sort of serious, complex cases of individuals engaging in self-harm which is hidden and isn't really necessarily for other people to be seen. So it's less about communication of distress in those cases. And staff talk a lot really about the emotive nature of self-harm, about when they became aware of a young person engaging in self-harm. There was a lot of fear and a lot of panic about what it was that they were supposed to do. I think as an interpretation of this sort of coping strategy amongst students, and how young people often use it as a coping mechanism when things are really tough or really difficult, and they felt that self-harm was a bad way of coping with it. This was sort of tied into the motivations of why they did it. And schools expressed a lot of fear again about managing self-harm and what was the right thing to do when it happened. So there's real concern about getting it right, and concerns about if it wasn't dealt with properly, that it might lead to serious consequences instead of suicide. And I think some of this is grounded in the reasons why schools might want to seek external professional help, so they could have some guidance in order to get it right. Then staff also talked a little bit about the pressure of the school context and the pressure they and students felt, which might lead to student self-harm. So teachers feel very pressurised to support those who self-harm, but they also talk about school as being quite a scary, high pressured, lonely place, that it's very difficult for students to manage. And then the final thing really about the conceptualisation and restructured what staff talked about in terms of moving forward and what they might do is they see self-harm as being part of mental health or along the continuum of self-help, along the continuum of mental health. So for them, they kind of really saw promoting mental health as being a way of preventing self-harm. So within that context then, thinking about what school processes currently for intervening and managing self-harm, we actually saw very little activity which was seen specifically targeting self-harm. So schools, based on that assumption that promoting mental health might prevent self-harm, tended to focus resources on that mental health promotion activity. And there was that perception of them being linked, but we saw a lot in the data about the fear of contagion and encouraging self-harm. So they were concerned that if they had assemblies, if self-harm was openly discussed within the school setting, it might lead to the behaviours which they were trying to prevent. So yeah, so we saw them trying to promote mental health and well-being to prevent self-harm and engage in sort of social emotional competencies and coping strategies. And there was some additional targeting for individuals who might be vulnerable or at risk but aren't necessarily engaged in self-harm. So self-harm was actually quite absent from a lot of the prevention activities that schools currently do. So this is just kind of an extension really of some of those points about really why they don't want to raise awareness of self-harm as part of prevention activities. So there's that fear of contagion. There's also a real lack of expertise. So they felt that schools and teachers don't necessarily know what to do or what to say to schools. And in terms of assemblies, they are prepared to do some activities based on alternative forms of self-harm. So there had been a drive towards child sexual exploitation, which was kind of talked at within the remit of self-harm, but they were reluctant to do about cutting specifically. Some talked about maybe doing stuff on signposting to websites and newsletters, but again, we're concerned about couching explicitly in self-harm. And a couple of schools did talk about awareness raising in PSC, where they spoke more broadly about safeguarding issues. So there is some stuff going on, but it is restricted, I think, by fear about what talking.
And do is there research to give us an idea as to that fear of contagion, whether that's a real thing or not? Or
well, it's one of the things that we're talking about doing next. So there is some stuff around suicide and contagion, and there is sort of a small amount of evidence which says that if your friends self-harm, you're more likely to self-harm. But the causal pathway in that isn't that clear, in that we don't know if people are friends because they self-harm rather than because one self-harms, their friends more likely to self-harm. So there's still a lot of unknowns there, and a lot of the fears we kind of need to substantiate a little bit more. So that's kind of the more prevention stuff. So in terms of the actual intervention and management activity, so again we saw a lot of sort of informal things going on. So schools had a variety of approaches, so there wasn't any standardization. It was kind of done on a case-by-case basis. And there was kind of a lack of explicit activity around self-harm. It tended to fall under safeguarding procedures, where staff would make a referral to the safeguarding lead or leads if they knew that a child was engaged in self-harming, and then referrals might be made on. So it was often quite reactionary and on a case-by-case approach rather than standardized. So we've just kind of put a little bit of a model together to see kind of the main things that happen and the dynamics that are going on in the school. So you'll see, I can't read here, there's a circle which says students self-harming. So if that is the young person engaged in the behaviour, then we kind of saw that that sits in the broader context of peers, which might influence that behaviour. But also peers often disclose to teachers when a friend is self-harming. But also there's a lot of fear about the interaction between different peers and the encouragement of each other. Schools also talked a lot about the increasing role of social media and encouraging self-harm. And then kind of moving on to key people in the school, we saw that when a disclosure is made or when schools identify some of the self-harming, it might be through social media, maybe through peers, they then move into action of identifying the key people that might deal with it, and that reaction being on the case-by-case basis. We also saw some discussion about the role of parents. So in most cases, parents are informed, and schools often try and support young people in telling the parents themselves about the self-harming. And then we saw that other dynamic then of the professional agencies. The schools maybe don't feel that well equipped to deal with self-harm, so they'll ask for advice or refer a young person to CAMHS and other services.
Did any of them mention the sort of difficulties associated with that, maybe sort of long waiting lists?
Yeah, so a lot of them spoke to feeling unprepared within the school to manage self-harm whilst they waited for a referral to come through.
Okay.
So then I think for us, then one of the key things I was thinking about, well, what do schools want in terms of self-harm, given what they've said? So they really want support around early identification. So something that they can do for themselves and tools to support early identification. So PE teachers were often one of the main groups of people who identified self-harm because they could see scars in the skin. So they wanted some help there. But this kind of being linked up these improved external links to professional services. So once identification was being made, they could pass it on to external agencies. But I think one of the main thrusts of what we found was that schools want more awareness and prevention, but not necessarily around self-harm, but about mental health and well-being, because they saw this as being a key and preventative strategy. So just some acknowledgements. And just to say there is a full report associated with the presentation.
Yeah, and that will be sent out to you at the end of the this webinar. And I think the link that we're giving not only gives you access to the full report, but also there's a sort of a summary brief as well.
Yeah.
Well, Rhiannon, that's really interesting. I mean, there are a few things that perhaps I'll ask a question if anybody else wants to sort of say anything. I think we will open the. I'm just looking at Mike.
All attendees are muted and may unmute themselves by pressing *6.
You know, what struck me was that there was, you know, quite a lot of things that would sit within what. You know, maybe a sort of national sort of strategy of sort of maybe providing policy practice guidance. Did anybody sort of want a sort of a national thing, or was it felt that it would be something that was sort of done as it is at the moment, which is sort of individual schools on a sort of needs basis?
Yeah, so I think one of the main things to come out was this idea of schools having even more of a focus on mental health and well-being, and that remaining sort of a key policy priority, that they feel supported in being able to do that. And I think at the other end, then what they really wanted was better resources and better connections with CAMHS and other health provisions that they might be able to then make those referrals on. So I think one of our clear senses at the moment that schools, although they see self-harm as a priority, don't necessarily see themselves as sites where they should be doing the intervention that they need, or because of this sort of lack of training and resources. So they just want better connections with external agencies so they can move that on.
Because the thing that seemed to come out was, and I've come across it just in terms of things like sex education and other things, is that if there's guidance on policy and practice, that can be quite reassuring to a school. You know, so maybe that would be that, plus, you know, lots of sort of intervention, you know, looking at mental, emotional health and well-being over the whole school, which, as you say, would, you know, could possibly have a sort of input. So, I mean, have you got views as to what you want the next steps to be? I mean, you've taken the network sort of along with you up to this point. Is there anything you want to say?
Yeah, so I think one of the things that has been most useful about this for us is when we had the original consultation, a lot of schools said that self-harm was a huge priority for them and that they wanted support in being able to deliver better and more effective intervention within schools. And I think this has been a really valuable insight into exploring that actually those things are much more complex than we thought. And you know, schools aren't necessarily ready or don't necessarily see themselves as places where we might start having assemblies or information sharing about self-harm. That's not what they feel they need at the moment. They want those mental health promotion interventions or those more sort of higher level relationships. So I think it structured what we're going to do moving forward slightly differently. So one of the main things we think we need to research a bit more now is this idea of contagion and whether discussions around self-harm will encourage other young people to engage in those behavioural practices, and that might be something we can take forward with the PhD. Then I think also is trying to progress the evidence base more on school-based sort of social, emotional and mental health and wellbeing interventions, because that's still very mixed. And then I think the other thing which we've recently put in a grant for is about those CAMHS provisions. So seeing how different agencies interact about CAMHS to deal with those more serious instances of self-harm that young people present.
So it is probably moving forward on a sort of multifaceted sort of,
and just responding to what the schools have told us they feel that they need and what the issues are.
And do you think that will still be with the GW4, will with these other universities as well? Or?
Yeah, I think part of it will, but part of it is with a different set of collaborators. So yeah, it'll evolve.
Well, thank you, Rhiannon. And you know, you all know my email address, so if you have any questions that you want to put to Rhiannon after, then please just email them to me, or you know, give me your details, and you know, perhaps Rhiannon can go back. We've just lost the screen. Can everybody still hear us? Oh, there we are. So I'm just going to finish now with just a very brief sort of network news, just to keep you in touch with you know, what else we're doing. So the next webinar, last year we ran one in each term, but the numbers in the summer term were low because you're all very, very busy in sort of, even though it was quite early in the summer term. So we're going to do 2 this term. So the next one is the 30th of March. And that's because you've all been, you know, that we had data from so many young people thought through the survey, so 35,000 young people, it means that we can actually look down at individual groups, and we've got some research that's come out looked after children. So that would, I think, be a really interesting one for everybody to join. Summer events, so this is for schools, and then Healthy Schools, we will be able to have one person from each of the Healthy School schemes around Wales to come to. We're having 3 network events because we're recruiting more schools, and that's where we prepare for the survey that will take place in the autumn term, but also look at feeding back research and getting schools to feedback on how they're using the data so we can share good practice. So make a note of the date. We will be in the next newsletter, which will arrive just before Easter, there will be opportunity for you to start signing up for those. Just one little reminder, and actually there aren't many schools left, but we did send out an email, and we'll send out another one just to ask schools to fill in a very short survey as to how they're using their student health and wellbeing report. So it would be useful for us to get that information. So if you're somebody who's thinking, oh, I need to do that, as I say, it will arrive again, and it'd be great if you could do that. So thank you for that. And just to remind you, we have sort of sent it out in newsletters, but we are opening recruitment to all secondary schools in Wales. So if you know schools in your authority who you think would be interested in being part of it, we're trying to recruit through Healthy Schools, but also information has gone out in DISC, which is the Welsh Government newsletter, because Welsh Government are a partner, and we're approaching lots of different ways. But if you've got a school that you know personally, then just give them my email address and tell them to get in touch. So I think that I was doing so well. I think that might be it. So it's not letting me go forward. So I think that I think thank you very much. And actually the timing is amazing. So thanks for joining us. We hope you'll join us the next time. And any questions, just get in touch. Thank you. Thanks.